Well, welcome back. And to reward those of you who made it back on time, we are going to begin because we have a whole lot of information we want to share in this next segment. This segment has a dual purpose. This purpose is to help us all identify ways in which we can work more closely and more effectively with our partners. And specifically in this segment, we are talking about our partners in the 10 regional public health training centers located across the country. Every time I'm part of a presentation where we're talking about the training centers, I like to ask people the question, and this is no shame. Raise your hand if you are currently in some way involved with the regional public health training center that serves your part of the country. So a few hands are going up. Okay, that's great. That's very, very good. By the end of this conference, we want all hands up. We want both hands up, in fact, because you will have not only learned more about, but also be linked and connected with training centers in your part of the country. I want to just recognize someone who's not in the room today, but who has been both a tremendous champion for the public health training centers as well as for public health nursing. Those of you who are, I love this new term, well, it's not a new term, but I love this term, seasoned public health nurse. Those of you who are as seasoned as I am, and sometimes I feel like I'm seasoned, marinated, basted, broiled, and sometimes fried, but those of you who are as seasoned as I am will remember Irene Sandvold at HRSA. And Irene has, for many, many years, been working very, very, in a very dedicated way to try to promote and create bonds and linkages between public health nurses and the regional public health training centers. So this session is all about helping to support and achieve Irene's vision. So use this session today, learn from it, and also share. The training centers are very much interested in addressing the needs in the workforce, and as we all know, public health nurses comprise one of the very largest, if not the largest, segment of the public health workforce in governmental public health. So it's absolutely imperative that we collaborate more closely. And this session is all about helping you begin to develop the tools and resources to do that. The person who has so graciously agreed to coordinate this part of our program today is Melissa, also known as Moose Alperin. I know her as Moose, and I'm sure she would be delighted if you called her Moose as well. Moose directs the Public Health Training Center that is based in the Emory School of Public Health, and she also directs the Executive MPH program for Emory as well. If Moose's face is familiar, she's been around a great deal. She's very involved with the states in this region. She's also very involved in American Public Health Association, which is how I initially came to know her several years ago. So without anything else at this point, I'm going to turn the mic to Moose.
Great, thank you, Shirley. So as Shirley said, I am Moose Alperin, and I am the director of the Region 4 Public Health Training Center, which is headquartered just down the street at Emory University. And we serve the 8 states that make up the southeastern part of the U.S. I am delighted to represent all of my Public Health Training Center colleagues from around the country today with this presentation. And in the next 75 minutes, the plan is that we'd like to share with you an overview of the Public Health Training Center program, some specific ways that public health training centers have and can meet workforce development needs for public health nurses, provide you with an opportunity to hear from a panel of public health nurses and hear their thoughts about where public health nursing is going and possible intersections with the public health training centers, and then end with some resources for you to know about. So the specific learning objectives for the session, by the end, you'll be able to describe primary activities of the regional public health training centers, describe multiple ways that public health nurses can engage with the public health training centers, identify workforce development needs for public health nurses, and then locate trainings and resources available from the public health training centers. I'll start with an overview of and the acronym we use is PHTC program. The National PHTC program was originally established in 1999 by HRSA, the Health Resources and Services Administration. It switched to a regional model in 2014, and we are currently in our second cycle as that regional model. There are 10 of us. There are 10 regional public health training centers, one in each HHS region. Collectively, we work with over 80 community-based training partners. We work with technical assistance providers and a national coordinating center, which is headquartered at the National Network of Public Health Institutes. Collectively, we are known as the Public Health Learning Network, and our purpose is really to improve the nation's public health system by strengthening the knowledge and skills of not only the current public health workforce, but also the future public health workforce, so our students that are coming along the pipeline. The next two slides provide a listing of each of the 10 regional public health training centers and then our coordinating center. And you will see the states or territories that are covered by each one of the public health training centers. In the exhibit area, which I understand will be available tomorrow, there is a Public Health Learning Network booth, and they will have some information about the training centers. So please make sure that you stop by and visit tomorrow. So the activities of the Public Health Training Centers really fall into three major buckets. We have training needs assessment, so figuring out what the needs are of the public health workforce, providing training for the current workforce, and then providing field placements for the future workforce. The work of the public health training centers, it's based on state and local needs that have been identified through our needs assessment activities. But in addition, HRSA has also asked us to focus on 8 strategic skill areas, which you will see here on this slide. These are strategic skill areas that are outlined in a document that came out in 2017, Building Skills for a More Strategic Workforce, a Call to Action. And these are a set of strategic skills that are needed by the public health workforce to complement discipline-specific skills and to allow for collaboration with individuals that are from other sectors other than public health. In addition, HRSA has also asked us to focus on some clinical priority areas in our trainings, and specifically they asked us to focus on mental health, opioid abuse, and childhood obesity. Just to give you some metrics and tell you a little bit about some of our work over the last 4 years, you will see that we collectively, and this is sort of the impact of us as a whole of 10 centers, we have implemented 4,500 courses, we have trained over 400,000 professionals, and then the number of public health nurses that we have trained, we only have data specifically broken out from the last year, and we think this is probably actually a great underestimation of who we have touched in terms of public health nurses. But you'll see that we can document 26,000 public health nurses that we have touched. And, you know, we really like to think of ourselves and are the nation's most comprehensive source of public health training and support. So I also would like to tell you a little bit about 2 other activities of the network. The first is the Public Health Learning Navigator, and this is a curated online catalog of really the best in public health training. It helps professionals find high-quality training, things that are relevant, that are accessible. It was launched about a year ago. There are 50 trainings that are currently included in the Navigator, and it is continuing to grow and grow. The other activity that I'd like to mention is the Strategic Workforce Action Agenda. And this is really based on the idea that increased capacity is needed to fully comprehend and communicate public health issues, to organize diverse partnerships to address the complex challenges that we are dealing with, to implement sustainable policy and health system changes. And to build this capacity, it's really important that we have a coordinated system of efficient and effective quality learning opportunities. And so the action agenda helps to highlight gaps and opportunities to have a more robust and coordinated effort towards workforce development. So now what I'll do, having given you a bit of an overview of the public health training centers, is shift to some specific examples of how the public health training centers have and can engage public health nurses. I have examples from almost all of the public health training centers. There are 17 of them. And as I go through the examples, 17 examples, not 17 centers. But as I go through the examples, what you will see is you will see trainings that were developed specifically for public health nurses in mind. You will see trainings that, while not developed specifically for public health nurses, nurses are an absolutely appropriate target audience for those trainings. You'll see activity related to FAB, public health accreditation, public health nurses who provide mentorship for field placement students, as well as training centers that work with public health nurses to provide other resources other than training. And I want to give you sort of the heads up that as you're listening to these and learning more about some of the activities, you will see some activities that are specific to one region, but know that many of the activities, especially those that are distance-based, the webinars, the online courses, those cross regions. Those don't stop at one region and you can't participate if you're in another region. Those are available to anybody with internet access. And so you'll see that there are lots of options for you, and we hope you will take advantage of those. So now what I'm going to do is I'm going to start sort of in the northeast part of the country with Region 1 and go through this litany. So the New England Public Health Training Center is an example of how training centers can support public health nurses directly through their own training, but also indirectly through affiliations that are within the same university. So by way of example, SHIELD, which stands for School Health Institute for Education and Leadership Development, is a training center that runs a variety of programs for nurses. On this slide, you see some examples of training offerings that focus on knowledge that is at the operational level. So things like mandated topics, community of practice and networking within the region, and hot topics. Here, we highlight trainings that target nursing leadership, both the Summer Leadership Institute and a community of practice and networking series of meetings which are aimed at school nurse leaders. And recently, Boston University School of Public Health sponsored a symposia on the role of nurses, including public health nurses, in changing population health. The discussions and the presentations can all be viewed online. With Region 2, we highlight a series of self-paced online trainings designed to prepare school health nurses to provide case management for asthma and diabetes among school-aged children. Not only were these trainings developed for school nurses, but school nurses in the New York City school system also helped create the content for the trainings. Region 2 also has a series known as Strategies to Advance Health Equity. This is a series of 7 self-paced online modules that highlight real-life practical steps that state and local governments have taken to overcome different challenges related to health equity. Public health nurses are one of the many audiences for this series. Region 3 is launching an inaugural Expo Exchange that will happen in June. Expo Exchange is a distance-accessible interactive forum in which participants will share experiential learning experiences, discuss projects, engage in panel discussions, and learn about career and networking opportunities in public health and clinical practice. All current and former HRSA-supported students, their supervisors, faculty collaborators, and community-based training partners are invited to participate in this. Here in Region 4, we offer a series of 6-hour skill-based development workshops to state, district, and local health departments that are called Public Health Practice Academies. The goal of the Public Health Practice Academy series is to provide public health professionals, especially those that serve underserved areas and underserved populations, with core skills that can be used in public health practice. Highlighted on this slide are 3 of the newest Public Health Practice Academy offerings, and while they weren't developed specifically for public health nurses, it's common that public health nurses participate in these trainings. In this example, the Region 4 Public Health Training Center collaborated with the Georgia Department of Public Health to assess the training needs of public health nurses and nurse practitioners in our state. And on this slide, public health nurses have also served as mentors for field placement students. So in this example, we had an MD MPH student from the University of Alabama at Birmingham. He was placed with the Porch Band of Creek Indians Health Department in Atmore, Alabama. And Cliff, who's the student, researched the prevalence of HIV and diabetes and best strategies for intervention in the Porch Creek Indian population, and he helped establish HIV screening at the health department. In his work with Nancy, who was his mentor, Cliff became more interested in working in settings that implemented patient-centered medical homes and telemedicine. The Region 5 Public Health Training Center held an on-site training for public health and nursing students at the University of Michigan just this past month, where they discussed the implications of marijuana legalization and the importance of cross-sector collaboration to promote health. After learning about the health impacts and the history of marijuana use nationally and in Michigan, the students participated in a policy advocacy exercise where they discussed roles, responsibilities, and the values of public health and nursing. They then worked in teams to come up with policy recommendations and talking points that were related to promoting healthy communities where marijuana is legal. The presentations are now being repurposed as an on-demand, online continuing education offering for professionals. In Region 7, health departments request assistance in meeting the FAB, or the Public Health Accreditation Standards and Measures. This assistance includes creating and conducting workforce development needs assessments, which are then used to develop training plans. Support for implementing and evaluating training plans is also provided. And some things that are coming up this summer in Region 7, mental health impacts in the public health system, and many public health professionals are looking for strategies to improve mental health outcomes in their respective communities. This summer, the Region 7 Public Health Training Center will be releasing a mental health podcast series featuring mental and behavioral health experts as well as professionals from primary care, education, public safety, and the business community. And these individuals will share their experiences, their challenges, and promising practices essential to creating conditions for all to have better mental health. Region 7 will kick off a sizzling summer webinar series as well on persuasive communication. The series will introduce learners to negotiation, conflict management, and the psychology of persuasion. Each month will take a deeper dive into the approaches and techniques on maximized intended outcomes. The Rocky Mountain Public Health Training Center offers distance-based training opportunities that address the important topics of change management, persuasive communication, population health, and equity. For those who work with clinics or healthcare systems that are interested in affecting population-wide change or addressing social and environmental issues impacting their patients' well-being, the Public Health Training Center also has a series of short videos on population health and action. The Western Region Public Health Training Center offers self-paced online courses as well as live webinars, which are available online through their Moodle site. These courses are free. They often are approved for continuing nursing education units, and some examples of the courses that are approved for continuing nursing education credits are listed here on this slide. The Region 10 Public Health Training Center offers a Hot Topics in Public Health Practice series of webinars that explore Public Health 3.0, population health, and becoming a chief health strategist. You can view the archived recordings and resource material on their website. In Region 10, the Northwest Center for Public Health Practice is now currently accepting applications for their 2019 Public Health Management Certificate. This is a program that is designed to help public health professionals, including public health nurses, build important skills to become successful managers in their workplace. And finally, the Northwest Center for Public Health Practice has multiple resources on their website, including Northwest Public Health, where these issues of this magazine explore different topics. So this has been a fast sort of around the country with different examples of what the public health training centers have been doing with and for public health nurses and things that public health nurses can take advantage of. As a reminder, if you heard something that sounded interesting and you live in a different part of the country, but it's an online course or it's a webinar, it's available to you as well to participate in it, and we hope that you will. So now I'm going to shift to the next part of the presentation, and we have a panel of public health nurses and would like to have some discussion with them. So if I can get Betty and Shirley to come up here. But we've got Betty Dixon, who is the Clinical and Nursing Services Director for the Coastal Health District here in Georgia with the Georgia Department of Public Health. So Betty serves a coastal area that is the southeastern part of the state. Shirley, of course, you know, who is the Executive Director of the Association of Public Health Nurses. And the third person who is joining us remotely is Tim Struna, who is the Chief of the Section of Public Health Nursing at the Alaska Department of Health and Social Services. We had also hoped that Michelle McLeod, who is the Chief Nurse for the state of Georgia, would be able to join us, and she was not able to join us at the last minute, but I think Betty is going to have some comments both at the state level as well as the local level. And I'll just quickly put these up here before I stop sharing the PowerPoint, and we can all then see Tim and get introduced to Tim. But what I asked our panelists to do was to explore 4 questions, sort of from their perspectives. What is your vision of where public health nursing is headed? What are the workforce development needs of public health nurses in this new landscape? What role might the public health training centers play in this new landscape? And if time and resources were not an issue, what is your dream for public health nursing? So with that, let me stop sharing. And Tim, are you still with us?
Yeah, can you see me?
We can.
All right, great. Good morning, everybody.
I was going to say that it's very early. We're in Alaska where Tim is. So,
Right.
I was going to say, he said his house is quiet. So Betty, would you mind starting?
Sure, I'll be glad to. So the first question is, what is your vision of where public health nursing is headed? And of course, my vision is some type of standardized training for all public health nurses. But at the local area, in the Coastal Health District in Georgia, we have 8 counties, some, There we go. Can you hear me better? Perfect. Okay, so from the local level with public health nurses, I see training, continuous training, and standardized training as the ultimate goal. But at the local level, I see public health nurses who are well-trained working more collaboratively with school nurses, epidemiologists, the local EMTs, physicians, hospitals, and other healthcare professionals and community leaders. In my future of the public health nurse, I see it as one where the nurse is at the center of a wheel, drawing information from all resources or from the different spokes of the wheel, and working with others to create a better community by identifying problems. As nurses, we won't just work with the uninsured and underserved populations. We will work with all aspects of the population to improve health. And we will also be sought-after speakers for different community organizations, for school nurses, for civic clubs, and for our local politicians. And I see us as subject matter experts of our community and our community's health.
Okay. Well, when I think about the future of public health nursing and where it's headed, my hope and dream is that it's headed backward. Let me explain. You might think, why would we want to go backwards? About 2 weeks ago, I had the opportunity to be in New York City with my son for a basketball tournament. And I had never had the opportunity before to go to the Lower East Side where it all began at the turn of the century. So I took that opportunity and went down to Henry Street and visited the Henry Street settlement. I was blown away. For one thing, if you've not recently looked at the website for Henry Street settlement, when you go home, or even before you do go home while you're here, take a look. They have done a very nice job of updating and chronicling the work of Lillian Wald and her public health nursing colleagues in the place where public health nursing in the U.S. Was founded, launched, began, and had its start. The thing that I learned, and I think maybe in some ways I knew this before, but it was made very real to me as I visited this exhibit in the house on Henry Street and saw all the artifacts there and heard voices literally of the nurses from that time period, of the people from that time period, oftentimes European immigrants, always in marginalized situations. As I heard those voices, heard those experiences, it became very, very clear that what we need to become in public health nursing is we need to become more like Lillian. Lillian clearly struggled with some of the same things that we do today. Lillian struggled clearly to help bring voice to immigrants, to other marginalized populations, to help their issues, their challenges, their needs to be known to others in the community, especially those who had influence and could begin to make a change, to improve the health of the population. How did she do that? Yes, some of it did involve going to those homes to provide services that were sorely lacking in terms of health care. But I think even more importantly, she identified and dealt with those things that we know contribute to years of lost life, years of lost productivity. And again, those are the social determinants of health. She worked strongly, very strongly in the area of education. She created a playground in the backyard of the house on Henry Street that now, as it's been transformed for the 21st century, is a great sport court where there were kids of all ages there outside enjoying, a beautiful sunny day in New York City. And then, just like everything, Lillian's work in the house on Henry Street evolved over the years, as did public health, and the focus shifted a bit, and especially sometimes some of that work had to be redirected into assuring health care access. And even, I think Henry Street even would tell you that focus shifted in that way a bit to assure those health care services. But nonetheless, I think that now we are recognizing that was an important need. We needed to do that. We did do that. And we must refocus, and strengthen in our ability to address those things that will influence health equity. All of those things. We'll talk about what specific workforce development needs that means exist for public health nurses, but all those things that we saw on the list a few minutes ago in Moose's slide deck from HRSA, all of those skills are going to be critically important to move that vision forward or backward.
And Tim?
All right. So it was great hearing Betty and Shirley. I think my comments are going to be very much aligned with what they've already mentioned. The vision for public health nursing, and these are things that we're actually really trying to put into practice here in Alaska as much as possible, and that's what we define as an integrated public health nursing practice, where the individual, community, and the system levels are informing each other in terms of where our focus goes in terms of our public health nursing population-based practice. And so that the downstream individual efforts are particularly focused on the marginalized populations, the ones that have either are unable or for a variety of other social determinant factors are not connected to a medical home. And we provide that targeted outreach and try and help those folks get re-engaged. And then also, having that responsibility for infectious disease mitigation, response, and contact investigation work. But then also paying particular attention to the upstream conditions where we know that almost up to 80% of an individual's health outcomes are driven by those conditions that are occurring outside of a healthcare system, and making sure that the conditions are in place where we live, learn, work, and play are going to afford everyone in the communities that we serve the opportunity for access to affordable housing, safe housing, good schools, healthy foods. And we know that there's no amount of healthcare coverage that's going to compensate for people who are experiencing high and constant stress, because these healthy choices or options are not equally available to them as they are to others potentially living just right down the street from them. And ideally, our public health nurses have the skills and the training to make sure that their investment of time in either these downstream or upstream conditions are uniquely based on the results of a local community assessment. And so that the workforce development that we are paying particular attention to in Alaska in order to be effective in this, in the practice that I'm describing, is really driven by an ongoing learning needs assessment based on the core competencies. And again, some of the slides that Moose had already presented, things that we identified as through our most recent assessment here with our Alaska PHNs, are systems thinking, mobilizing partners around a common goal and sort of feeding that into a community health improvement planning process, having a trauma-informed practice at both the downstream and upstream activities, and then being having a very solid understanding of the data sets that are available, helping to translate that into action at the community level, and then feeding that into a more broad or comprehensive community health assessment. And then the last question with what might the Public Health Training Center play in this landscape? But again, we're lucky to have a designated nurse consultant that pays particular attention to our staff development needs. And she, I think, has been very effective in harnessing everything that we possibly can from our regional public health training center. And we've actually have had the ability for the second year in a row to have a very tailored training provided to our management team. And we're looking forward to that upcoming in May. So I think I'll stop there.
Great, thank you. So go back and see if some feedback. Whether Betty and Shirley, whether y'all have thoughts about some workforce development needs from your perspectives.
I'll start. So yes, we definitely need to enhance our workforce development. And as we mentioned earlier this morning, the workforce development needs to start in the nursing schools, and it needs to continue on throughout the lifespan of the nurse. So in the nursing schools, if time and money were no object, it would be great if we had more intense collaboration with the schools, and the nursing schools would incorporate either community health, public health, whatever you want to call it, nursing into each of the programs, into chronic disease, maternal child health, etc., so that they would see that the person who comes in with diabetes and goes home with diabetes is going to be back into the hospital with diabetes unless the community supports it with good stores that have more than just fried foods and snacks that are not appropriate for a diabetic, so that they can see that public health nursing is part of the community. And to have public health nurses come and speak to the classes. I know that in my district, we only see nursing students for one day, and I heard someone this morning say that they have a 2-week rotation. I think that would be great, provided that we have the nurses that in public health that can have a student shadow this nurse. Now, along the way with training, again, it would be wonderful if the schools of nursing, and of course Region 4 does a very good job of this, of offering more online training that keep our skills, our clinical skills up, but also that help train us with other aspects that we need, such as leadership, community speaking, etc. So start getting back with with the nursing schools, if we could have as a nation, or certainly maybe start with a state, but as a nation, have some type of public health certification or degree, I think that's where we need to go. I think we need to be recognized. I know that England does this. Now, in England, you have to be a midwife as well as a public health nurse. I'm not saying we need that, but we need some type of recognition as a public health nurse. So workforce development, it certainly involves training, and it involves all of us sharing the type of training that we have so that we can have best practices. STDs are basically the same. TB is basically the same. Maternal child health is all basically the same. There are variations based upon where you are, where you tweak the programs, but these core competencies are the same wherever you go. Shirley? Yes, thanks.
In terms of workforce development, there are so many things and so many opportunities where we can begin to improve our practice. Again, that list of those priorities from HRSA, I think, are all key. I think if I were going to try to prioritize, I would say when there are opportunities to improve in terms of systems thinking, that is really essential. What does that mean? It means a number of things. One thing I often hear from not only public health nurses, but other public health professionals as well, health educators and others, is the yes, but comment or question. Well, yes, but I know health equity is important, but those are not things that we do in our programs. Those are things that happen in another county agency, city agency, community-based organization, fill in the blanks. It may be the case, indeed it is the case, that those other organizations have a key role in that, and in fact, they may be the leaders. However, it is very much your opportunity, I would say even your obligation, to think about how do you influence, how do you bring your influence, your credibility. As a nurse, we know nurses are the #1 most respected profession. We know that because we have one foot in healthcare, one foot in public health and population health, by virtue of being that boundary spanner public health nurse, we can be I would say not just part of the solution, but really the solution to helping to think across the existing boundaries of components of the system that all need to be better aligned, work more closely together to improve population health. That term that's kind of new but is increasingly being floated around, chief health strategist. Sometimes it's community health strategist. At first I heard worry about, well, who is that? I can't be that because I'm not in charge. That has to be my boss. You can be the community health strategist from wherever you are, bloom where you are planted, and think about who is it? Who are the individuals, the organizations, the partners who need to be part of the system, whose resources can be brought to bear to improve the situations that you're dealing with in your work. Go knock on a door, make a contact, like we said today, collaborate, make new friends. Recently I was at a meeting where a young public health nurse who was gung-ho and fired up about PSE, policy, systems, environment, went to knock on the door literally of her county planning department And she said, I was so enthusiastic. I went to talk with him about how we can work together. And they said, well, we're not really quite sure we see this yet, but, come back later and we'll think about it and you come back again. So she wasn't deterred. I think she was a little disappointed that they didn't immediately know, yes, we know all about policy, systems, environment. We're here to help. They needed some educating, some cajoling, some encouragement to see that, yes, in the new world, we all work together. We work across those boundaries. So it takes some boldness. It takes some courage to begin to go and knock on those doors, to begin to form those alliances. And it's absolutely something that's within public health nursing.
Stepping out.
Yes, stepping out.
So any thoughts about the roles of the public health training centers?
Thank you for the training centers. We have taken great advantage of the training centers. What was mentioned earlier today is, and I'll just speak real briefly on training for public health nurses. At the local level, I have about 60 nurses that work in clinics and do home care nursing. And I think as a state of Georgia, we have 1,400 public health nurses. They all love face-to-face training. Face-to-face training is very difficult because they are out of the health departments while they are attending face-to-face training. So as we look at the future, I see more online training. And I see online training in short bites. It's really helpful if it's less than an hour, preferably 45 minutes, and really more like 30 minutes so that they can fit it into their day. And sometimes this training has to be segments because you can't say everything in just 30 minutes, but maybe a series of trainings. And what I have found useful with nurses is, as you mentioned, Shirley, is for the most part, we are fairly adept at our clinical skills and know where to go to get more clinical information and up-to-date clinical information. What we are not as adept in is the HRSA priorities, such as systems thinking, persuasive communication, and pervasive. Emergency preparedness, policy engagement, cultural competency, problem solving, and data analytics, especially data analytics. The health of the community, the health assessment of the community. One thing that we did in Georgia as a state is we did Reach Out and Read and Talk to Me Baby. These are two different programs. Through our data assessment, we realized that very few of the school-age children in the third grade could in fact read on a third grade level. And I continue to hear this rumor, I'm not able to track it down, but allegedly the criminal justice system looks at the children who cannot read on the third grade and they start building prison cells. I've never been able to track that down, but I keep hearing that. So as a state, we have embraced Talk to Me Baby, which is a program where we have trained our nurses to teach parents how to talk to their children. Most mothers work. And so when they pick up their child from daycare, they pick up their child from school, they're taking their child to daycare, they are constantly talking to the baby so that the baby hears so many words. And parents will say, particularly when they come into WIC, they'll say, well, I don't need to talk to my baby. I've got the radio on. The radio can talk. But it's the mother's voice. It's voices that they understand and that they're with. And there is research that shows these children learn more because they've heard so many words, and also reading to their children at an early age. In every clinic in my district, when a child under the age of 5 comes in, they get a book. Now, we had to start writing their names in the book, saying, to Johnny from Nurse Betty, because when they would come to the health department, they would recognize that book and they would pick the same book over and over again because it was the only book they had and it was the only book that they recognized. But we would write down the name of the book in their medical record so that when they came in again, they could select a different book. And we are beginning to see, we've been doing this now for a few years, that the parents are coming back in and they're saying, you know, my child can read. He could read before he went to kindergarten. Now, kindergarten teachers sometimes don't like for these children to be able to read, but that's okay. You know, we are doing what we can to break the cycle. So we have begun talking to civic leaders, and we now have different programs and different community agencies that will bring gently used books to the health department. So that's an example, but getting back to persuasive thinking, persuasive communications, data analytics, these are skills that we don't have to the level that we should have as public health nurses, so we can be more engaged in our communities and seen as people who know the problems but can also recommend solutions.
Ditto everything Betty said, and I think also time is short. Training, unfortunately, is often the first priority to go and be eliminated from the training budget in agencies. I think to have short, concise opportunities for learning that can be made available wherever, whenever. I love the idea of the podcast. I'm very excited about that. And in fact, our partner from the University of Iowa, the Public Health Training Center that serves Region 7. Our partners are with us today. They're videotaping this session, and as well, they're recording interviews with each of our plenary speakers from the conference that will be converted into podcasts in the leadership series. So I think finding ways to be innovative and continue to infuse educational opportunities into conferences, wherever, whenever, State Public Health Association meetings, certainly into the APHN conference. We hope this is the beginning of a new trend, not a one-time event, so that we can begin to build upon that strong basic skill set that we have, but to augment with those additional skills that help to advance health equity.
So I am going to take facilitator's prerogative and skip the last question to give the audience a chance to do some thinking. But before I do that, I want to give Tim, it was coming, y'all just weren't letting me get there, want to give Tim a chance to chime in as well.
Yeah, actually, I feel bad. I think I probably breezed through all three questions during my one opportunity for the microphone. So I was okay being silent because I kind of embedded all of the responses that I wanted to have with the time that I had. So really nothing to add now. I would like to hear from the audience and hear questions from that perspective. So.
Okay, well, great, thank you. And what we would like to do is give you all a chance to think about some of these issues. So you should all have a yellow index card and a blue index card, I think. So what we'd like you to do is just sort of cluster with the people you're around, and we'd like you to explore and jot down ideas for two questions. The first on the yellow card is, what are the current and future workforce development needs for public health nurses? And then on the blue card, how might public health nurses and public health training centers collaborate? And so just chat amongst yourselves, sort of with the people you're next to. We'll give you, probably about 5 minutes to do that, and then we'll hear some of your thoughts. So there was great buzz in the room, and it sounded like great conversation was happening. And I hope y'all will, if you didn't jot things down on the index cards, if you will, we would love to collect those index cards as you leave the room. What we'd like to do now, and I was going to use poll everywhere to do this, but I'm on the fly going to abandon that and just have us have people share from the audience things. But there are going to be two questions. What are top two now, just top workforce development needs for public health nurses from y'all's perspective? And then how might public health nurses and public health training centers collaborate? And I am going to stop sharing so we can pull Tim back in as well, just so you can see him if, great, there we go. So let me just, first question, what are some of the top workforce development needs for public health nurses that y'all came up with? Shout them out.
Defining what is public health nursing 3.0 and how to apply it.
So defining what is public health nursing 3.0 and how to define it. No, and how to, I'm sorry, how to provide it.
Definition and application.
Definition and application, okay. Other, social determinants of health.
Nurses on boards and civic engagement.
Say again?
Nurses on boards and civic engagement.
Nurses on boards and civic engagement.
Systems thinking.
Systems thinking.
Prioritizing workforce development as a need.
Prioritizing workforce development as a need. I heard somebody else say leadership.
Kind of building on what they said, making the connection and integration of public health 1.0 and public health 3.0 and how what we've been doing fits in the population goal.
So the integration of public health 1.0 and 3.0 and how what you've been doing fits into population health. The brain isn't as sharp this morning. Other things?
Data analytics and chief health strategist.
Data analytics, chief health strategist. I saw a hand up over here.
Yeah, making public health concepts valued in nursing education and practice.
Making public health concepts valued in nursing education and practice. Let me come over here, then I'll be back.
Management leadership training.
Management leadership training. Quality improvement training.
Raising the salary.
I mean, very real, raising salaries. Betty's going to talk about that.
Trauma informed.
Trauma-informed? Is that trauma-informed practice? Care practice, okay. Yeah. I'm sorry, say again? I'm missing the first part. Managing for change. Are these things resonating with y'all? I mean, I'm hearing sort of heads, seeing heads nod. Anything else?
Going back to more population and community health, so we're less solid, like they said up there on the panel earlier. And then going back to the leadership class and leaders, along with a mentoring program, as was mentioned earlier, for people already in place to continue their education. Things already talked about.
Okay, population health, mentoring, leadership, continuing education, continuing people's education. In the back.
Our group was spoke towards and there was an overlapping area we found was more information on data gathering and orientation on the public health diversity role.
So data gathering and orientation on public health nursing board? Roles. I can't hear, sorry about that. I'm trying to repeat it so we get things captured. In the back there.
Making public health nurses' voices heard in the community so as to bring more recognition.
So making public health nurses' voices heard, public health nurses' voices heard in the community for additional recognition. Great.
Increasing public health workforce diversity and implicit bias.
Increasing public health workforce diversity and implicit bias.
Community engagement to address public health issues.
Community engagement to address public health issues. Those are all great, great thoughts. So to shift to the next question, do you have suggestions of how public health nurses and the public health training centers might collaborate? You've learned some ways that we are collaborating, but are there others?
If public health training centers see the need for continuing education and making sure that all their offerings provide those nurses with the continuing education, they invest the time, and the training centers could invest in structuring their programs so they are able to receive continuing education credits.
So it's a real focus on continuing education for nurses and
Not the only, but if the public
Okay, so making sure training programs are eligible for continuing ed for nurses.
All you gotta do is ask. In Colorado, if you reach out to the training centers, we did in Colorado, and we developed Public Health 101, and it was a collaboration between the training center and public health and nursing. And we got this outreach, and we have a website, and you can go on the website, just like in North Carolina and everywhere, and all you gotta do is ask.
I think sometimes as well it takes a champion to help figure out who can provide the nursing credits. So helping public health training centers who aren't connected to providers, helping us identify who that might be, and that would be an additional collaboration to be able to then offer and meet the need for you all.
They have
So,
the resources and they have the work, the staff also, that can do what you need to do.
right, great.
Could there be a search function on the homepage for the training centers where you plugged in like motivational interviewing? All of the MI trainings come up from all the 10 centers, so you don't have to go into each one. And would this HRSA training center be willing to host a PHN residency as a core resource?
So hosting a public health nursing residency, and then also thinking about sort of search functions across the public health training centers. And I think I'm probably not in a position to necessarily address all of these, but to take things back to the group. But one of the things I will also say is make sure that you've got the Public Health Learning Navigator on. It is not everything the training centers are doing, but it's some of the best of the things that the training center's doing, and the number of offerings will continue to rise. So that is also one place to make sure that's bookmarked. But I recognize that's not what you're asking, but I heard that too and jotted it down.
So for the public health 101 in Colorado,
My question would be, is that available to all of us, and then would the CEU transfer to all states?
So the question about different courses and whether it's, how it translates in terms of availability to other people, and then sort of the transferability of the nursing credits from one state to another.
Right, because we don't have to repeat if it's already been.
Right. And I'm jotting notes down more than doing that direct response back to every single comment. But I will say that I know when we have conversations about Public Health 101 in Region 4, sometimes what the need is a general Public Health 101 that really does cross that a training that's really well done meets the need. And sometimes Public Health 101 is state-specific or geographically specific. And so it becomes an issue. And I'm sure we could get you information about what's included in the Colorado one, and we can make some assessments on that. Other thoughts? Well, these have been some great ideas. In our remaining time, let me give Tim, Shirley, and Betty one more opportunity to sort of share some final thoughts with you, and then I will end with a couple of slides about some additional resources. So, Tim, you want to go first?
Yep. Can you hear me?
We can.
Okay, great. So it was great hearing, and thank you for summarizing. I couldn't hear what was being said from the audience, but all the things that I've listed out here match very nicely again with that recent learning needs assessment that we did here in Alaska. So I think there's a very much a common theme across the nation in terms of workforce development needs for public health nurses. And, I guess if we had to boil it down to two things, what I sort of see gaining traction here in Alaska is hospitals working to figure out how to do a social determinant of health screening. And then what we are sort of engaging in discussions with is that feeding aggregate data of these social determinant screening results to the public health nurse to then inform and drive our public health nurses' action at the community and the system level, and then feeding back that information to the hospital terms of continuing to help them move or leverage their infrastructure towards a value-based funding mechanism. And so I think having a very strong grasp of the social determinants of health, what they mean and their impact and how to address them, I think it would rise to the surface for me. And then that data analytics. So once we get this aggregate report, what does it mean for my community, and how can I then turn that into action by mobilizing partners? So I guess those are my final thoughts. Thanks.
Thank you.
I'll be brief. I think if we're better trained and have a louder voice, we will be better paid.
Absolutely. I want to say that we have a lot of opportunities ahead for us through APHN. All of the needs that you detailed, I think many of them are addressed in the next 3 days of this particular conference. But I think moving forward, earlier I mentioned when we were speaking about the public health nursing residency of APHN actively looking to pursue resources for residency. I think not only that, it's important that we sort of practice what we preach, and we think about the systems thinking approach to addressing this. Clearly, we will never find a pot of gold at the end of any rainbow, but it's going to be incumbent on us to engage our foundation partners, organizations that we all know and love, like Robert Wood Johnson Foundation, de Beaumont, and others who have a stake and investment in nursing as well as in public health and who want to see both advance. Also, our partner organizations. APHN, as you may know, is an affiliate of both ASTHO, the Association of State and Territorial Health Officials, as well as an affiliate of NACHO, the National Association of City and County Health Officials. We're working very diligently to make new inroads into those organizations so that they too can see the value and see the future and why it's important with public health nurses, again, being the core of public health on the ground in communities in every single state all across the nation. To improve public health and improve population health, we need to advance and improve public health nursing practice. And also, I think HRSA. I think it's time for us to go and probably reacquaint ourselves. Irene, I think, is still around the last I checked anyway. I need to reach out to her again. We all should, I think, explore opportunities with that organization that may exist for us to look at future improvements for workforce development for public health nursing. So.
Will we all join me in thanking Shirley, Betty, and Tim? And I am going to share just a couple of final slides, which are some training resources. So we've been talking all about the Public Health Learning Network and the individual public health training centers, so hopefully you will not forget about us, as well as the Public Health Learning Navigator. Also wanted to talk just real quickly about some of our partners. So CDC Learning Connection, CDC Train, National Train, which is an initiative Public Health Foundation. And then finally, sort of leave you with the hope and the request that you connect with us and let us connect with you. I have enjoyed getting to learn from you and in the future learning with you, and we will look forward to these connections that will continue to grow between the public health training centers and public health nurses. Couple of things as we wrap up is we would love to collect those index cards. So I've got two colleagues in the back of the room, Michelle Carvalho and Hannah, and I think y'all are going to sort of probably plot yourselves one at each door. We'd love to collect the index cards. And the other thing is if you'd like to be on Training Center newsletter, if you will give us your business card, we will divvy them up to the appropriate region and ask those regional public health training centers to put put you on their mailing list. And then finally, when the exhibits are here tomorrow, stop by and see the Public Health Learning Network exhibit. And tomorrow morning, 10 a.m. in the Bass Room, go learn with Jennifer McKeever more about the Public Health Learning Navigator. And with that, thank you so much.